With us, we continue with the conversation on alcoholism tonight on To The Point with my guest, Reverend Dr. Stephen Mairori, Nakada Board Chairman Kevin Carey, petitioner to have alcoholism declared a national disaster in the country, Crispus Kimaru, an addiction counselor and a recovering alcoholic. And in a few minutes, we shall be joined by Professor Seth Oketch, who is the chairman, APRAC, that is Addiction Prevention and Rehabilitation Association of Kenya. Let me take you through these numbers quickly, and let's talk alcohol prevalence in counties. According to Nakada, Western region accounted for 23.8%, coastal region 13.9%, central Kenya 12.8%. That's according to Nakada. And on manufactured legal alcohol prevalence, Nairobi topped the list with 10.3%, central Kenya at 10.0%, and eastern region at 8.4%. How about the use of Changaa? Now, western region came in first at 11.4%, Nyanza came in second at 6.3%, and the Rift Valley at 3.6%. So let's now get into why we are having this conversation tonight, which is because of a petition to Parliament to declare alcoholism a national disaster in the country. But on what grounds? Now, according to petitioner number one, Kevin Carey, who is here in studio with us tonight, number two, John Wangai, and Mr. John Mushoki Mbudia, part of the reasons are that the cheap homebrew called Changaa often contains methanol, a toxic non-drinking type of alcohol that can cause blindness and even death. That, number two, that when alcohol consumption is taken too far, the user's family feels the effects, neglect, misuse of funds, and increased domestic violence, which are all two common results. And three, that children born from parents abusing alcohol are likely to have learning disabilities, thereby affecting their education performance. Kevin, I'm sure I've left out some of the reasons why you're having this petition.
Yes,
Over to you.
The major, maybe to add on what you have just said here, the other reasons that maybe are caused as a result of alcoholism, you find is the issue of the brain damage. When you talk of brain damage, you're looking at, addiction is a disorder of the brain. Number two, we have the slurred speech that is caused as a result of alcohol consumption. Number three, we have the impaired memory, whereby people take to the extent of now the next day asking, kwani jana kuliendaje? Because they are unable to recall what happened in the process of them now consuming that alcohol. Then the other thing that is now the adverse effect that as a result of consumption of alcohol, you find that people who drive, when intoxicated, they end up even affecting the sober people. And your right ends where the other person's right starts. Yeah. And the moment now when you drink and maybe go to an estate where you live and you start causing mayhem, you start disrupting the peace of your neighbors, you start again now disrupting the peace of your family. Because again, you can't get home and you start maybe now beating around your spouse. And as a result of you beating around your spouse, now the gender-based violence affects now the children now at school. If a child was to wake up in the morning, the child now again won't, the concentration level at school again is now lowered because the child maybe slept hearing those noises of parents arguing. Then number three, you find that this person, actually the victim who is consuming this alcohol, he or she was supposed to report maybe either at work, either at 8 a.m. or before 8 a.m. But now, as a result of this consumption, the person is unable to report that early in the morning. So again, we have now the reduced skill that he or she possesses at work. So if the person was a senior person in the office, so you should be sure now that whole department or that whole agency where the person is senior, now that agency for that day has told, because he or she is the one who's to show direction of where the need is supposed to go. For instance, if Chair here was a victim of alcoholism, you should be sure now the direction Nakada would head, which will not be the direction that he's supposed to go. So we thank even the leadership for appointing him, because I know he's his teacher. He's a person who will be able to steer Nakada to ensure that we achieve the desired goal of actually declaring alcoholism a national disaster. Yes. Right.
So let's move on and take a look at what it is that you want from Parliament. And the three petitioners are calling, did I say petitioners? Petitioners are calling on Parliament to compel the national government to declare alcoholism a national disaster. That's A. They're also calling for the national government to establish a national task force to investigate the root cause of the vice in the country. And the long-term solutions to curb the violence, they are also pushing for increased taxation of alcoholic drinks. And what else?
Yes, yes. You know, to compel national government to declare alcoholism a national disease, it started with the president. You know, president, when he appointed his cabinet, the first order that he told them was, I don't want to see any alcoholic in my cabinet, because he also understands the nature of work that is required from his cabinet. So in us supporting that rallying call, we are now telling the parliament to now compel national government to declare alcoholism, such that we have suggested parameters of now declaring now alcoholism a national disaster. And you know, you start even at the workplace. We can have someone who will monitor the situation of employees, personnel. Has anyone reported to work drunk? You start there, and you know the journey. I know it's a serious hurdle, but with commitment and goodwill, I think we're able to achieve on issue number one. Number two is to the establishment of a task force. The reason being is most of the time we rely on statistics. We don't know how maybe this statistics was done, but if a national task force was established to now check on the root cause of this vice, we now need to identify, now from this task force, maybe the report that they're going to give us is what is the major root cause? How is the second generation of alcohol? Where did it start? Where did the rain start beating us? And maybe when are we expecting our Damascus moment? Because in every situation, we usually have a Damascus moment. And before we wait for a victim to experience that Damascus moment, why don't we assist these victims, maybe whom majority of them unknowingly are now slaves of alcohol.
So on this second point, are you by any chance insinuating that, you know, the agencies that are currently in existence, and NACADA here, led by Dr. Suwari laughing, sir, are you insinuating they're not doing, you know, their job?
No, you know, there's a limit to what a person can do. And you know, most of the time...
Why don't we make use of the people we have?
You know, like NACADA right now, the powers that they had initially were devolved now to county governments. And you find most of our county governments are the ones that have maybe caused the rampant issue of second generation alcohol, because either one person financed you, and now you returning a favor, you are now allowed the person to conduct now those illegal businesses. If we're able to reinstate back the powers of maybe licensing liquor joints and being able to monitor, I think maybe we can go back to, the chair here can be able to take back us to the Mutudo moment, or the Michuki moment in the transport industry. Yes.
Is that true, Chair?
Yeah, I agree with Kevin. And first, I want to thank him for I think he really understands the problem in the country. And I think I'll hear more about the petition and get to know how he wants to go with it. But I want to say that I think we have issues that we can fix now. And one of it is just the enforcement part, because in NACADA now we are dealing very seriously with the issue of supply. Because if we can cut the supply, then we reduce, you know, those joints that you are saying, all those type of things. But we have legal problems now because the counties are increasing the supply, and you know, they are licensing all these people. We are engaging the governors, but if that law was repealed or was changed so that NACADA is able to do that, then it's much easier for us through the national government to take control and assure Kenyans that we are able to do this. But now we still have to negotiate. We are also working hard, and I am glad Seth will be joining us. We would like to really work hard on the demand reduction, which is helping those who are already affected so that they have treatment. And then we do a lot of campaigns now. We'll be, from next year, you'll be seeing a lot of rollouts in schools, in universities, to try and sensitize, to educate the people. But I can assure you, Grace, that this thing is manageable. I think if our laws are aligned and punitive measures are put in place in the law, so that those who practice this have to pay very heavily, this thing will be dealt with.
Right.
And it is very doable.
Right.
Yeah.
Okay. At this point, I want to rope in Professor Seth Oketch. Do we have him, Mr. Inonda? Great. He's the chairman, APRAC, that is Addiction Prevention and Rehabilitation Association of Kenya. Prof, good evening. Thank you for joining us. Sorry, I know we have kept you waiting for too long. Apologies, Prof. But welcome on board. Yeah, your quick reaction to this.
Thank you. Really appreciate it. I think this is really a timely initiative, particularly the one on making sure that at least we have deliberate discussions around addictions in this country. I think for us as an industry, our major concern is really there's so many Kenyans who are addicted and do not have access to services. So I'm really delighted to be here, and I hope my contribution will go a long way in reaching the petition.
Right. And so what if this passes, if it pushes through the petition to, declare alcoholism a national disaster in this country, what does this mean for the rehabilitation centers that we have in the country?
I think it means a lot. As you realized from the data that was shared, we have about 100 accredited rehabilitation centers. When you look at the capacities of those centers, the bed capacity is about 4,000. But post-COVID and with the difficult economic times, many people are not able to afford rehab. So if you look at the capacity under which the rehabs are operating right now, is close to 50%. So declaring it a national disaster, in our opinion, may be able to create opportunities for more resource allocation that will go a long way in helping people to, particularly the folks at the bottom of the pyramid, to access rehabilitation services. But even before we get there, I think the chair could really, to help us with this one. We already have rehabilitation funds in a number of laws, and I was just hoping that there's an opportunity to be able, even within the upcoming task force, if this was to be declared a national disaster, so that we bring the players, for example, the county governments, which the chair mentioned, also the money that they collect from, liquor licensing. 30% of it is actually supposed to go towards rehabilitation. And we hope that there could be a consolidation of this. We have the Mental Health Amendment Act that has some resources for rehab, as well as the Narcotic Drugs and Psychotropic Controlled Substances Act. So I just feel like this will go a long way in creating more resources to scale up the rehabilitation. Even though when you looked at the data that was shared there, it was about 1.3 million people, but we think that there are many more Kenyans that are actually underreported under the category of those that are addicted. Right,
and I could see Dr. Stephen nodding in agreement. Doc, let me just wrap up with him, okay? I'll come back to you. Because, Prof, I want to talk again about the rehabilitation centers. And my question would be, we see, do I say so many? I don't have the statistics to back me up, but we see cases, let me just say cases of relapses after rehab centers. Why is this?
Well, so I think one of the things that people really don't understand is that addiction is a chronic disease, okay? So the management of the disorder is long-term, but what rehabs do is to provide acute management, simply to be able to provide some stability. So after rehab, really, there needs to be aftercare or continuum of care, so that when people leave rehab, then they should be integrated in some sort of either residential or outpatient transitional program. Now, for a lot of families, they can't afford. And when you look at also the distribution of rehabs in our country, when people leave, it's just very difficult for them, especially those that come from, rural counties, to access, transitional services. So I feel like it looks like, maybe we're not doing a good job, but that's really not true. I just feel like people don't understand the nature of addiction. If you look at, and not just in our country, you can look at this everywhere. The success rates, is pretty much close to those ones of chronic diseases. But I feel like if we have a spectrum of care, that will really help in terms of making sure that when people leave rehab, they have some support. Even when they relapse, they quickly get on track and, the frequency and the intensity of relapse reduces. So the criticism, in my opinion, is fair, but I also think that part of it is just based on people not understanding the dynamics of this disease and how to manage it. So rehabs are just like if you're diabetic and then you get to hospital, then you're stabilized, and then what really happens after that is really important. So that whole spectrum of lifestyle change and recovery management, we feel like it's really missing. And with this, this petition was to go through, we hope that that's one area that would be developed, fully.
Right. All right, thank you. Thank you so much. Prof. Seth Okech there, Chairman, APRAC, Addiction Prevention and Rehabilitation Association of Kenya. Thank you, sir, for your time. Thank you for waiting. Once again, so sorry, our sincere apologies for keeping you waiting for that long. Okay, Dr. Stephen, you had something to say? Do you know how many minutes we have left?
15. Yeah.
Saba.
Yes.
What's that, Dr. Stephen Anze?
Yes. What I want to say really is to give Kenyans hope. I know the situation looks dire, but even to encourage my friend Kevin, there are low-hanging fruits that we could go for faster. And some of them, as Seth has said, I think we need to work together to see that these funds that are already, in the law, you just need to align it so that the rehabilitation facilities can have. Work with the counties. Currently, we are telling the counties those money have to be ring-fenced. Certain amount has to be given to CBOs, has to be given to these groups that are helping the fight. Don't use this money to pay salaries. Don't use this money to use for your trips or anything. It's by law ring-fenced for this purpose. Those are things we can win quickly. And then as the national government, we are working very hard now on supply separation. And I feel and I do know that that is very doable. We've had a few of our officers who probably get compromised, but we are narrowing on that.
Let's talk about that. What are some of the challenges in this fight? Because we were talking about students, primary school students,
yes.
Secondary school students,
yes.
and these companies, the alcohol companies would, in their defense, say that they put up a caution. Excessive consumption of alcohol is harmful to your health, strictly not for sales to persons under the age of 18.
Yes. So
what are the challenges?
Yeah, one of the problem really, I would be honest to Kenyans, is it's enforcement of the law. I don't think the law is very clear, but we've had issues on enforcement of the law. And if you have had, our CS has been very categorical on that going forward, we're going to enforce the law seriously. The Deputy President has also been on the same, and so we're working out through the Ministry of Interior to see that this is realized.
Right.
That will reduce quite a lot, because then treat those ones who are affected. I feel we will be heading somewhere. Yeah. I'll be honest with you, Grace, again, just to say, I think in the past, we've not had very serious help, probably, I should say, from the agencies that were supposed to do. But now we have a president, we have a deputy president, we have a CS of Interior.
There's goodwill.
There's very high goodwill. And even for us as NACADA, we feel very supported. And we will be seeing a lot of change.
Right, right.
And I even wanted to encourage even Kevin to say, probably as you work with Parliament and all that, let's see the quick wins.
Yeah, sure.
And then we shout.
Okay, Kevin, I'll come to you.
Yes.
We need to know how far this petition is. But Mr. Crispus, there's a question here. I believe it's for you. Someone asked how someone can know they're addicted. We did answer that, which are some of the signs. We talked about that. But there's a question on kindly brief on ways to prevent addiction rather than detoxifying. That is Quira Francis. Brief or talk about ways to prevent addiction rather than detoxifying.
That's for somebody who is already consuming alcohol.
Yes.
Okay. The first thing, okay, I would have liked to maybe address that, but let me address the question first. The first thing, for someone who is already consuming alcohol and you think there's a problem because already it's causing you problems, then the first thing you do is own up. You have to own up that there's a problem, and that's where we all started in our recovery journey. We started by owning up that there's a problem. And number two, we said these are a mental health issue. These are medical problem. It's not a criminal issue. issue. So if it's possible to see somebody, a professional, like Professor was saying, this is a disease that needs to be treated. And you need to see somebody, a therapist, a counselor, somebody who can help you professionally. We are not talking about detox, we are talking about psychotherapy here. And then it's a chronic relapsing disease. So even after seeing a therapist, you should continue with the sessions. There are so many coping mechanisms that we handle or we offer on a case-to-case basis because every situation has every addiction situation has its own underlying issues. You'll find somebody who is in addiction because maybe they have childhood trauma, others have marital issues, others have low self-esteem. There are so many issues. So the people think because of so many emotional issues or psychological issues. So we deal with them on case-to-case basis. But own up first, see a therapist. That's my toolkit before you go further. And then, because I know I don't have more time, it's a good that Kevin is taking this initiative. It's good that Daktari is talking about supply. But for a long time, since I was a child, we have been trying to curtail the supply of alcohol in Kenya. We have invested so much resources in fighting alcohol. Actually, one of the successes that NACADA says it has done is pouring 2,000 liters of alcohol. 100. But what I'm wondering is, do we have anything to show for it? Isn't it time now we may be focused? Kevin, this for you. Isn't it time now we focused on the demand? Why are people going for alcohol? In 2014, when Uhuru was the president, in central Kenya, there was a campaign to pour alcohol and all that. But I remember, because I was in addiction at that time, we switched to other things because we were still in addiction. So even after curtailing, even after pouring the alcohol, we still needed something to solve our issues. So you will close 1,000 bars, but we'll go to Domicam or other prescription drugs because we still have underlying issues. They have not been resolved. Why can't NACADA now, please, focus on maybe reducing this demand? Why are people consuming alcohol? Why are people moving from the high-end alcohol to the cheaper, to Changaa and the others? Is it because they want to get high fast? No, it's because that's what they can afford. Can we now stop this? I went to Nyeri for the first meeting by the deputy when he was talking about the alcohol issue. NACADA was only given less than 5 minutes for the presentation. The interior government, the chiefs and the county commissioners and all those, they were given so much time. And I was sitting there, only 2 MPs from central Kenya talked about alcoholism as a disease. Right. Maybe it's time to change the strategy. All right. Maybe it's time, or we can balance the supply and the demand. Okay, listen, and Kevin, gentlemen, we're out of time. Yes. I'll give you a minute each. Yeah. Yes. Your closing remarks, remember. Yes, yes. But I'm closing remarks, but just answering him. You can't fly on one wing. Yes. You have to fly on both. Yes. That's the approach we are taking. But I want to tell Kenyans that it is possible to win this war if every Kenyan became as angry as Kevin to say we need to stop this. Because we can take charge of our community. I use Kijabe as a place where when the community said no, they were able to win. And so every Kenyan, please fight for your next generation. Right, right. And let's clear our space. Right. Mr. Kevin, how far are we with the petition? 30 seconds. Now the petition is on the public petition committee. And it's also good as a petitioner. I note maybe the gains that the government has done so far. We are saying that the government now has looked for opportunities for the youth, local and abroad. Looking at some of the initiatives the government is doing, is trying to reduce the idleness and the joblessness among the young people, because that is among one of the factors that leads people to join now these vices. Carry on, carry on. Number two. They're chasing us like anybody. Yes. Number two, I want to call upon relevant state actors to support this petition, because I know shortly I'll be working with NACADA, I'll be working with the rehabilitation through Mr. Seth, so that now we are able now again to ensure that we achieve the rallying call of this petition. Number three, I'm calling upon the national government to support county governments in establishing county rehabilitation centers. Reason being, these rehabilitation centers will be now accessible to the common Mwananchi. Right. Because now we find private rehabilitation centers are very expensive for Mwananchi to afford. If the goodwill and support can come from national government to enhance the county governments, I am certain we're going to have the affordable rehabilitation centers. Number three, and the last one,
is now the goodwill that I'm talking about. Sorry, the goodwill that I'm talking about. We are looking at the multi-agency team that is being run by the Deputy President.
Right.
Being enhanced, now being a national team.
Right.
And now we are seeing now the activities taking place in Coast Region, Nyanza and Western.
Okay, 30 seconds, Mr. Crispus.
We need a multi-sectoral approach to alcoholism in Kenya. NACADA should work with the community, it should work with the churches, it should work with the APRAC, it should work with everyone. Let it not be a campaign led by only the interior government. That way we are going to lose.
Great.
And there is always hope. I recovered, everyone can recover.
Perfect, perfect. After 17 years.
Yeah.
Great place to end. Thank you. Thank you so much, gentlemen, for your time and your contribution. Reverend Dr. Stephen Mairori, NACADA Board Chairman, Kevin Carey, petitioner to have alcoholism declared a national disaster in the country, Crispus Kimaru, addiction counselor and recovering alcoholic, and of course, Professor Seth Oketch, who joined us via way of Zoom, Chairman APRAC, that is Addiction Prevention and Rehabilitation Association of Kenya. My goodness, I feel like I'm rapping. Inonda, namaliza. So, thank you for watching. Thank you for your time and your company. Thank you for your feedback. Meneska here says the show has been great and educative. Thank you so much for that feedback. Thank you for your time. Thank you for your company. My name is Grace Kuriakanja. Thank you to the entire crew. You're even making me forget, what I want to say, Inonda, the crew that made this production a success. We appreciate it. So, sir, have a blessed night. God bless you.